When some patients are on the verge of death, they begin to act differently. They begin to control parts of their body that they never thought possible. And I've seen this many times because we have ways of bringing patients to death's doorstep and bringing them back safely with modern medicine. It's called general anesthesia, using medications like propofol that I'm holding here. Anesthesia isn't sleep or a nap, even though we call it that in front of patients all the time. Anesthesia is actually a deep medical coma that turns off the organs throughout your body to varying degrees, including those organs that we associate most with life, like your brain and your heart. It sounds terrifying, but when you're monitored by your doctor, it can be incredibly safe. And it gives us an opportunity to expand our minds to accomplish things we never thought possible. I'm Dr. Anthony Cave, a Stanford and Harvard-trained anesthesiologist and integrative medicine specialist. I was taught that anesthesia was a medical coma that you go into, you come out of after surgery, and that's it. But after several years, I realized there is a lot more to it. A lot more going on in your deep subconscious that patients need to know about. The first is that the unconscious brain has a powerful effect on the mind and body. We see this especially with pain, one of humanity's most unpleasant experiences. In 2020, researchers in Germany had this crazy idea of putting headphones on patients under the coma of general anesthesia, and they played continuous recordings to the patients of affirmations of safety, confidence, and control over anxiety. They wanted to see if patients could wake up with less pain. This sounds like a joke, right? Because surgery hurts, and when you're under anesthesia, who's listening? And researchers were surprised to find that the message made it through. They were so surprised that they even labeled their findings under the title of Dr. Strange. Patients woke up with less pain and less opioid use for 24 hours after surgery. This has been repeated successfully, and I'll share those new studies at the end. But why do you think this happens? Let me know below if you have any ideas. I think it's related to not only turning off the brain with anesthesia, but more specifically, turning off the self-doubting parts of our brain. My second example is a personal experience. We've all heard stories of elderly grandmas and grandpas who with a sudden surge of adrenaline can lift up a car to save a pet or a child. Years ago, I had an elderly woman go under anesthesia and wake up with incredible emergence delirium. Emergence delirium is when we wake up kicking and screaming completely unconsolably. Our brain is in some sort of danger state and it's moving and kicking around without any external stimuli making it into the brain to be able to calm down. I don't believe this patient had ever stepped foot into a gym in her whole life. But when she was waking up delirious, it took 4 adults, one of whom was me, to keep her down and prevent her from hurting herself, ripping out her breathing tube or pulling off her bandages. Where did this super strength come from? We can't know for sure, but I believe it may have to do with anesthesia turning off those parts of the brain that are always telling us, you can't do this, you're not strong enough. And by doing so, revealing incredible physical and psychological strength. Before we move on, if you enjoy learning about your hidden healing potential, you can always learn more with my membership, Medical Secrets Exclusive, for direct access to me in private live streams where you can ask your more personalized questions. Or you can visit me in my ketamine and NAD clinic in San Francisco. Moving on. In 2022, that same group of German researchers that studied headphones giving positive affirmations to reduce pain wanted to take things one step farther. They wanted to see if they could provide positive affirmations to reduce nausea and vomiting in patients after surgery. Nausea and vomiting is very common after surgery. It can be from the anesthesia, from the pain medications, or even from the surgical pain itself. And nausea can be so severe after anesthesia that some patients need to be hospitalized just to keep the nausea under control after surgery. So this group wanted to see if the subconscious brain could help reduce the nausea after surgery, and their findings were exactly the way you think this is going. In the patients at highest risk of vomiting after surgery and feeling miserable, they were able to reduce the nausea. No medications, no intravenous infusions, just no thoughts, no self-doubting thoughts. To be clear, none of these are substitutes for professional medical care. But many of us have experienced medical conditions, certainly I have, where modern medicine doesn't have an answer. Doctors like myself can't explain what's going on. We can't name the condition. We don't have a diagnosis or a good treatment. And many of these conditions result in physical and emotional pain. I want my patients and you listeners to know that when we silence the mind, like when we are on death's doorstep under general anesthesia, that we have an incredible healing potential. We just have to get out of our own way. If you appreciate learning just how much power you have over your healing, please hit that like button below and share what you've learned with others. Your support helps me do this for you more often.